graduating from
school, coming back from Florida,
May.
38.8 miles.
So he's got his college in.
They do 90, 95, and 99.
It's fourth Monday. High potential for a fifth Monday tomorrow.
All right, it's 1 minute after 1. We'll get started so we can get out of here and hopefully beat the snow for some of us. And we'll start off with roll call.
William Beavers.
Here.
Tara George. Here. David Simmons.
Present.
Margaret Wilson. Here. Ray Baker's excused. Rebecca Denino. Here. John Farquhar. Jim McCready.
Here.
Mark Souza.
Here.
Ron Warner. Ken Kirk.
Here.
Jill Dunham. Josh Wells. Carl Turner.
Present.
Tom Pasquarelli.
Here.
Michael Schwartz is excused. Ken Chakowski.
Here.
Aaron Robinson. Is his excused? Okay. Anthony Agresta. Sid Chase.
Here.
Same. Myself. Tim Foster. Victor.
Here.
Damon West is excused. Dan Bixby.
Here.
Howard Huth.
Highlight of my week.
Owen Hahn.
Here.
Ben Luch. Peter Nichols. Lou Jones. And Dr. Markowitz has asked to be excused. We have a quorum, sir.
All right. Introduction of guests.
We have, can't read his handwriting, Dave Brennan.
Sorry.
That's okay. Who will become a member of our council at this meeting for Hamilton County to replace Avis Warner, who has resigned. Sierra, okay. Fountain, from Lake Valley EMS, and Ryan Peinel, who has been a previous member of this council. Welcome, everyone.
Can you leave anyone out?
If you,
I forgot to sign.
Tim Rattle.
okay, and if anybody hasn't signed in, please do so.
All right, everyone should have received the minutes from January 24th meeting. Anybody have any additions or corrections? If not, I will take a motion to approve. Sid Howard. All in favor?
Aye.
Correspondence?
The majority of the correspondence will be listed in the minutes. However, we did receive a resignation on February 1st from Avis Warner, resigning from the council. And everything else will be in the, either covered as business or in the minutes.
Chairman's report, I don't have anything of any importance, let's put it that way. Secretary's report.
Everything that I have will be covered in other committee meetings.
All right. Treasurer's report.
Give me 1 second. The only account that had any changes since last meeting was the REMSCO account. The opening balance was $1,130.49. Deposit of $2,500. Bills sent out were for our insurance, the Holiday Inn, and a service fee for an ending balance of $1,457.08.
All right. Any, the only thing I want to add to the Treasury report, we did receive notification from the Department of Treasury regarding the SBA loan that Phil had taken out, that I will be calling on to get the specifics. Apparently, nobody has access to this, and they're just wanting payment of the amount that is not what we borrowed. So I will work on that. Any questions about the Treasury report? If not, I will take a motion to approve. Second. All in favor?
Aye.
Abstain? Or no? Perfect. Regional program update.
Okay, EMS award nominations, sent out a reminder yesterday. I'll send out another one, just to get everybody going on this. I haven't received any lately. The last one we got I did forward to Beth, but that was only one of them. Credentialing update, Royce Terry from Sydney, new paramedic, or at least for Sydney, and Jasmine McDonald, Lake Valley paramedic. Agency ops, I think this might have been an update, Lawrence Fire District. Only one BLS modality went through this month, that was BLS iGel for Bovina EMS. Health Commerce, I do have the access now, I think I said this last month, if anybody needs assistance or needs enrollment, let me know. I know I've done several ARMS reps in the last month or so. State meetings were last week. I sent a program director report to Beth. She could circulate that if she wants. ARMS REMAC, I don't know if Dr. Fisher will talk to that or not, met on January 30th. The next ARMS/REMO REMAC meeting is scheduled for March 6th at 3 p.m. And I believe that link is up on the website. Dr. Shamani, I said, are in the process of completing the ARMS audit or review. Actually, they completed it, got it yesterday, and Tom should have everything. And I'm still waiting to hear from our website developer to create that ARMS link on the website. And that concludes my report.
So Tim, can you clarify with Lawrence, was that just you think just a renewal?
Emily sent me that, I'll double check.
Training.
Ooh.
You want to talk about the possibility of your course? No, we didn't. That was good. I didn't see your lips move. Boy, there's a lot of buses going around the room. Watch out.
Let's do it. Let's just get it.
We could do this under training, or we could do this under
CMAC.
but I guess we just handle it now. Go ahead, Beth.
All right, at CMAC REMSCO last week or week before, the med standards, training and education, and CMAC all forwarded a motion to REMSCO to set up a timeline to sunset the critical care technician level. And it was passed by the full REMSCO. Essentially, it sets up, I'll just read it because it's easier. Commensurate with the acknowledged concerns regarding the curriculum, scope of practice, and comparable national standards, while also allowing providers, agencies, and regions to prepare for the sunset of the New York State EMTCC, should follow this procedure and time frame. All expired EMTCCs can continue to refresh at the AEMT level via established processes indefinitely. The final EMTCC to paramedic bridge shall commence in April 2026, thus to coincide with the below. The ALS collaborative protocol will remove the EMTCC level of care when implemented on the annual revision timeline at midnight on July 1st, 2027. All currently certified New York State EMTCC shall expire at midnight hours on July 1st, 2027. and be automatically recertified at that time at the level of AEMT for the duration of their current cycle. All EPCR platforms in use in New York State shall reflect each previously certified EMTCC by their new level at midnight hours on July 1st, 2027. So that was passed. I have gotten a list of all of the critical care technicians in the region. Montgomery County has one, and this is not by agency, this is by county of residence. Hamilton has 4, Fulton has 5, Delaware has 6, Otsego has 22, and Schoharie has none. I've drafted a letter to send out to every critical care technician that basically says, hey, this is happening and these are your options. Giving them the 3 options: 1, allow your card to convert to AEMT. 2, attend a paramedic program if you wish to advance your level of certification. Or 3, attend the New York State Critical Care to Paramedic Bridge program offered by Northwell Health. And I feel like we should send this to everyone so that we don't get the I didn't know this was happening. So I think there are 38 total or something like that, and I think it's worth the cost of 38 stamps.
Any other training?
Or any comments on that?
I think it's sad that they're doing that, because in another word, right after they did that, now all of a sudden they're doing a task force and they're complaining they don't have enough medics, you know. To me, it's kind of crazy, but I know there's nothing I'm gonna do about it, but I think it's terrible that they're doing that. You're gonna have several, I mean, I know of several medics that been CCs for years, and now you're gonna lose them. And I'm gonna tell you, if I don't do the bridge program, I lose my job.
I think you're not the only one in that position. I think there's, you know, when I look at the list, I see people who are chiefs of municipal agencies who are going to have to do
It'd
probably.
be a different story if the state had plenty of, you know, medics and stuff like that, but they're complaining they don't. Now they're doing a task force, and on the other hand, they just, you know, if they wanna help us out, pay for the class. How about that? You know?
They do actually, they pay for the class.
In
We gotta pay up
after.
front.
And, yeah, right, but just, it's like every other course sponsor, right? So if you pay, I think it's $2,000 now, you get $2,000 back once you pass that course. So the course is ultimately free to any provider that wants to advance.
It is the least expensive, most flexible, easiest way to get a paramedic card in New York
I
State.
understand that. I totally understand that. But at 57, 58 years old, do I wanna go through another year and something of schooling, you know?
I get it, I really do. So, the only thing I can tell you is that I was on the 2017 tag that started looking at this. We looked at the data across the state, and they made a recommendation originally to run it for 10 years. The state, through their levels at the REMSCO, finally pushed something out that wasn't what was our actual recommendation. Because we also had a clause in there that said if you were CC, just let them be a CC until they stop. Let them naturally sunset. So the state picked differently. And then the state recently came around and was like, well, we want to kick this back to training and ed to come up with a closing date. And, I pushed back against it because I don't think this is a training and ed issue. This is a state ops issue. But it was what it was. It got pushed back to us. We turned back around and said, look, there was real movement from a group of providers and physicians that were trying to understand how to maintain CCs in protocols and in medicine when the CC scope of practice or standard of care is based on a 1996 curriculum, because we just don't have a comparable ed standard nationally to go with. And although we all know that most CCs practice above that, and some CC classes taught way above that. The group that was looking at protocols started asking questions like, well, how do we have CCs providing XYZ when that's not in the educational base? The scope of practice isn't there. So there's a real push to sunset this right now. And I think while most people will look at this as what we got as a compromise, Training Ed fought for this for the 3.5 years out from now, so that we actually had compromise and some lead time to get stuff done. SUNY Cobleskill stepped up again, and I told them that, look, we're in this. If you have rural places that are looking to get this done and they can't travel and they can't commute, we'll find a way to do this. We were about halfway done putting 50 grand into AV into our classroom, so if we need to do even remote lab sessions, that's something we can talk about also. We can talk about weekend sessions, night sessions, like whatever we need to make it work, we can make it work. But in 3.5 years, there's resources out there to get it, and I think part of the trouble is, and I put this bluntly back on the state, is if they had done what we asked back then and said, look, you have a 10-year window to do this, people would have moved on it. But they didn't do that. They left this soft open end with no date. And now they closed it, which they need to. But, you know, it's still at least 3.5 years. And I know there was a large group of people that were seriously looking to end this right now. Because it's gonna be hard to defend, to go back and say, well, this skill level can do these 3 things, when those 3 things are not in the scope of practice. So it's awkward all the way around. But I will point anybody here to, oh God, I can't remember Bonnie's last name. So one of the county coordinators out in Allegheny County came to CMAC REMSCO 2 meetings ago. She spoke passionately, she spoke well. She stepped forward and she's like, hey, my county can't handle this, you're going to decimate us, her words. After the meeting was over, I went over to her, introduced myself and said, how can I help? Explained to her that the bridge program that Cobleskill actually helped Northwell put together for a curriculum is essentially just fronting the money, but then you're going to get it back. And then that the modules are self-paced. So you're blocked in certain big time frames, but there's no like you have to be online on Tuesdays at 2 p.m. or something like that. So it's flexible for folks to be able to do. And then the skills, verification or practice locally. So if we're local for you, we're going to make it work for you. If we're not, we got to do it someplace else. We'll try and figure out something for that. You know, we just don't want to see providers not be able to bridge up to paramedic. This is something that should be able to happen. The other thing, and Jack and I were talking about this, where he gave me a little piece of information that I didn't know, was that this is 3.5 years, so it's 2027. So there's a group of CCs, and we looked at this in 17, when we looked at the data. There are CCs that will be well into their 70s by that date. Most of those are not going to continue to provide or may not be providing at that age. Some obviously are, and our region has a few of those. But when the state looked at the actual number of patients that would be affected by the lack of CC across the state, it was minimal. Because the areas that were still holding on were rural areas or Long Island, really. And Long Island has a ton of facilities, hospitals that are close by for short transport, and paramedics. So that large group of CCs was almost negated immediately. And then when you start looking at other places, like Bonnie from Allegheny County, we spoke. She came back to this last meeting last week and spoke again to the group and said, hey, look, in the period of 3 months, we fixed this. She's like, I didn't know it was out there for resources. I put her in touch with her local paramedic program. She's gotten people into the local paramedic program with advanced standing. We do the same thing at Cobleskill. So if you're a CC and you want advanced standing, come contact us. If you can test out of stuff, you test out of stuff. It's that easy. You're only going to have to go to the stuff that you need to bridge up to if you're competent at that level. And the bridge program still exists. So there's room to make this okay. She turned right around and said, 17 of my 24 are set. And she goes, I know within the next 3 years, the remainder, most aren't going to recertify as CCTs. They're going to go down to AEMT. So I'm glad, you know, I know we all look at this as like, you know, it's going to hurt us. I don't think it necessarily has to. I think it's just something that we need to work together to address now. So if we can do that, I think we're going to be okay. But it's tough to explain, it's tough to explain keeping the level when you look at patient care standards as they're set across the state. And when you looked at the impact on the straight data, it was small. Now that small, thing, when it's in your neighborhood, is a big deal, I get that. But I think the state probably made the best of decisions to do this in the time frame that they did. We talked about maybe lengthening it out a little bit, and we had kicked around the idea of maybe 2030 instead. But there's a large majority of folks who have already bridged. And Northwell, I was speaking to one of their assistant VPs, and he's like, the numbers are continuing to drop, where we're getting less and less CCs that are actually getting into a bridge program in the first place. So they're starting to wonder how long they're actually going to run the bridge. So, I get it, but if you need help figuring it out, like I said, Mark, just reach out.
I actually had my medical director sign my paperwork, but I'm still not totally sure if I'm gonna do it. And I feel that, I teach CPR, and I said, CPR doesn't work most of the time, but we train because of that one time that it does work. And my thing on this is, you lose somebody and that one person doesn't save somebody, is it worth it?
Yeah. The split on it really became the data they were really trying to dig down to, and it's just tough to get that clean data at the state level. The answer is, because keep in mind too, that you're not losing the CC, you're losing the gap between CC and AEMT. So what they were trying to find is how many patients that needed CC or paramedic care wouldn't receive it within X amount of time across the state. So immediately they were trying to discard anybody that had paramedic coverage even from some other agency to be able to come in, or a local hospital that could have provided that care and then stabilize and transport out. So I think they did a good job trying to figure out the actual data for impact, but even the 500-600 responses that came back, a lot of them were just kind of emotionally charged sort of stuff as opposed to data-driven, how's it going to affect patient care across the state. So, but like I said, get a hold of me. If Allegheny County can figure it out, we can figure it out. They have way less resources and more CCs than we do.
All right. Transportation standards.
I'm going to forego reading through everything that we've done so far with Headwaters. I will tell you that we do have a public hearing set. It will be March 7th at 1 o'clock at the Town of Stamford building at 101 Maple Ave, Hobart, New York. The public hearing officer will be Lee Burns. I have not received fitness and competency yet from the state. I will make sure that I get that. Town of Richfield's application for CON is out to committee for determination of completeness. What have you got, Maggie? Found it to be complete. I will forward it to the state for fitness and competency and set up a public hearing. The last one we have is the Village of Cobleskill application for transfer of ambulance service certificate to Cobleskill Rescue Squad Incorporated. I finally received it. It has been sent to committee. However, I'm going to let Tom speak on it because there are some concerns.
Yeah, so the committee looked at it, and Maggie had brought up a point on whether or not we can act on this particular CON application or TOA. It's a municipal CON that is not transferable. So I'm working with Dan Clayton at the state in regards to it. I did have a conversation with him. We cannot, as a committee, act on this at this point. And we will be generating communication. This was already, from what I gather, this was attempted back in 2012, or there was some talk of this in 2012, and the Department of Health already made a ruling. Lee Burns in particular made a ruling on this, trying to do this TOA. So Dan is pulling that information, and I will be working with him either tomorrow or Monday to generate some sort of a response in regards to that. So, committee can't act on that CON at this point. That's it for transportation standards. REMAC, Doc?
I have the report, would you like me to? Yeah, sorry about that. REMAC met by Zoom on January 30th. In terms of membership, they added Dr. David Afienko. He works at Tri-Town Regional Hospital, Fox, and Albany Medical Center. He trained at Albany Medical Center and is medical director also at Del Mar Bethlehem EMS. They also added Dr. Michael Jastrzemski, who was an internal medicine doctor, and he was for many, many years involved both at the regional and state level through the Central New York region. He was a medical director and I think regional medical director as well. He is medical director for Skenevis and Richfield Springs, Village of Richfield Springs Ambulance. He will be, and he's the health officer of the town of Richfield Springs. Sydney EMS changed medical directors. To Dr. Stephen Hassett. Davenport ALS First Response notified us that they are now Davenport BLS First Response Unit. Village of Richfield Springs added Dr. Jastrzemski as a medical director. And there's been a request that the physician, Dr. Markowitz has asked that they try to decide among themselves who can take over the CNAC seat. He is hoping to retire from being our representative, but he wants to not just walk away, he wants it to be a transition where we're still represented. New business, Dr. Smith asked about the Leave Behind Narcan program, and I believe that the program agency was going to get involved in that. There is a YouTube link for training on the REMO page. And the big thing was that Emily brought up that there are some, and she didn't say what agencies, but she said that there have been at least one agency who asked if ACLS and PALS cards have to be maintained. And that in the past they had been allowed by the region to not have a current ACLS and PALS card. And the REMSCO affirms that to be an ALS provider in an agency, that a current ACLS and PALS card must be maintained. And that was unanimous. That's it.
Can I ask a quick question?
Yeah.
Dr. Smith, what does the Leave Behind Narcan program consist of?
The Leave Behind Narcan program is when you've administered Narcan and the individual does not want to go on to medical care. And it would be leaving a Narcan kit with instructions on how to get to rehab and other social services. And you would leave it with a significant other.
Is that something that's being funded by the state?
No,
No?
not formally that I'm aware of, although I've been hearing.
Opioid overdose prevention program and Oasis.
Oasis.ny.gov is a source of free Narcan. Colony Police Department has specific kits with more than just the drug, but has how to take care of the narcotic addict.
Tim?
And so,
We have it. If
Okay.
you wanna get a hold of me, we can set you up. We're an opioid distributor. Or you can go to New York.
For the record, Tim's been out of the opioid business. That's why he's pushing Narcan.
Just go to NewYorkOverdose.org and you can walk through the process there as well. But if you're looking to get a program up and running, give us a holler, drop me an email.
Yeah, our county has recently established 6 locations where there's free Narcan available in a kit like that. with the
Yeah,
instructions.
we have the kits, we distribute them to the agencies as they need them.
Good.
I just know how much we pay for Narcan, I just wanna make
You
sure
wanna
that someone else.
make sure you should.
This
probably
is
check
not
with public health,
Narcan
too.
restock for your drug kits or anything
No, I
else
just
like
didn't,
that.
I didn't know if we were supposed to be handing out the stuff we pay for, so.
No, public health, your public health department probably has it as well. We do ours through Montgomery County. There are little blue kits that come with all sorts of different things, chapstick and water.
Yeah, each county has a task force for opioid.
Yeah.
I know if you're emergency management. Well, I won't tell you that.
I also started on the shark
Jim, if you want, just catch up with me later. I use them where I work.
The only other thing we have for REMAC at this point, and it's both for council and for REMAC, is that Montgomery County EMS would like to go from being a BLS agency to being an ALS agency. Currently, they have 5 EMTs and 1 full-time one paramedic, and they're hiring full-time civil service paramedics. So they have filled out the regional application for approval of service to provide ALS level of care at the paramedic level. So I think that needs to go to REMAC at this point, unless somebody has any other comments.
I guess my other question is, we have 2 REMAC docs here. How many do we need?
You have to, no, do you? To have a committee, you have to publish a committee meeting?
Just email roll call votes for it.
Why don't I do that? Why don't I do an email roll call vote and, and get just everybody's agreement? That's we're not agreeing.
I don't want to, we should not prevent REMAC from delaying agencies to provide a service. That's my whole goal.
I will send out an email later today to all the REMAC physicians. I'll scan this in and get it out to them and ask for an answer by midweek.
Just a question for clarification. Do we have in our bylaws, or is it a state mandate that it has to go through REMAC? Because it's the REMSCO that actually does the permission.
Okay, so I don't know, so I'm willing to take guidance.
Yeah, Tim, what do you think?
Say again?
For an agency to go from BLS to ALS, traditionally, I know both in Hudson Valley and here, or Hudson Mohawk and here, we've gotten a REMAC blessing, approval, whatever, and then it goes to the REMSCO to do the vote. In the absence of a REMAC meeting, though, can the REMSCO just act on it?
Typically in our region, we have an ALS upgrade procedure, whether the BLS is going to AMT or medic, outlines a number of bullet points criteria-wise that they have to meet.
Right.
They check the boxes like that, then it goes to our REMAC.
Because here in what the application, it says, we agree to adhere to all operating standards, defined by the New York State Department of Health, the Adirondack, the REMS Council, and Medical Advisory Council. So it is saying
Okay.
both. But I think it's something that we can get
I think
Always
it's,
traditional in a roll call, email roll call. vote.
email roll
Right.
call vote.
so that should be fun.
If there's time between the meetings.
I think what we should also probably start to look at, maybe we want to form like a small committee to look at this, is just policy procedure, like what procedure, how we're doing this, and maybe take a look at what REMO has as far as their standards to go to ALS. I know we started having this conversation a few years ago, and it kind of died out, but I think we should probably get the physicians involved and find out if we're gonna push to an ALS level, what do they really want out of that ALS level, and what do we expect as a region?
Okay. I think that the packet that's here is comprehensive in terms of lots of questions.
I mean, this is the form that we've been using for years. It is a procedure. You have to answer all these questions. You have to have all of this documentation and provide it,
Yeah.
you know, medical directors, all of that stuff. I mean,
Your medical director has to sign off on it, you have to say you have the insurance. They ask for certain policies. In fact, there's a whole policy.
Does it address like ability to do staffing, response?
no.
So I remember having done these with Remo before, you know, you'd have an ALS coordinator and a medical director come in and actually present and field questions after the application was put in, and allowed for really figuring out whether this agency, when they go ALS, is going to be able to fulfill a need and keep up with that. I don't know if we
But I
want to
know
look at
This
that
goes
here.
back to the
Right.
credentialing thing, right? So ultimately, at the end of the day, do we have the ability to credential or say you can be ALS or not when they are a state-approved
Right.
system?
I know.
So I wanted to say this, talking to Joe Farrell before he retired, because we have a BLS agency, I was talking about upgrading. He said it really came down to medical director and state. It was
Right.
more of a formality through the REMSCOs and the
Yep.
REMAX.
Yep.
So I'm actually now very curious on how this is gonna be done, because I wanna still do that.
We've done this 100 times. I
Right.
just,
But we don't have a 24/7 standard like some of the other places do.
Yeah, nor probably
But
should
it wouldn't
we,
work
but-
here, the 24/7.
I mean,
Yeah,
it's
that's
no
very-
different than if an agency wanted to be BLS. We don't,
I know.
we don't
Right.
have the ability to
Yeah.
stop that.
All right.
And they have a medical director that says that they want that.
Well, look, for the short term, I'll put a motion out there if you want, just to send this out for a REMAC vote via email.
I'll second it.
I'll second.
Any questions?
I would look at, I think that we would start by looking at Article 30, Section 3003, which defines what Regional Emergency Medical Services Councils.
Truthfully, can we just ask the state for clarification?
Sure.
Right, because,
Yeah.
I mean, that's the governing body that even allows us to sit in this room, right? So let them kick it to legal. I know they're looking at it already. Because otherwise, really what we do is kind of silly, if we're just a pass-through.
Agreed. Moving on. State Council report.
Yay. State Council met on Wednesday, February 7th. I'm just gonna start in order, not in order of importance. NEMSIS 3.5 is out. Any agency can move to NEMSIS 3.5, but it will be mandatory by July 1st. Vital Signs will be in Rochester in October. There is a special operations and rescue track that has been added for the year, and there will be a NAMC Level 1 course. The EMS Memorial is not on a Tuesday this year, it is Wednesday, May 22nd. There are 8 honorees who will be going on the wall. They're hoping to have the new memorial ready for this year's ceremony. There was approved new ALS collaborative protocols with the effective date of 7/1/24. All new protocols will change once a year, July 1st. There will be a change log that comes out with them to say, hey, this is where it's changed. I am waiting for it to appear on the website before I distribute anything, because everything I have is draft, do not distribute. The BLS protocol changes with a change log are also effective July 1st. We discussed the CC. There will now be the ability to use calculators on all New York State EMS certifications exams effective July 1st, 2024. That does not mean that people are bringing their own calculators. It means PSI is turning on a calculator on the computer that you are taking the exam on.
I was super stoked to get that one through.
Well, that would have gave me a couple extra points on my test.
Me too. Would have prevented me from taking my shoes off.
The Federal Siren Act grant has large sums of money to give away. They are really encouraging people to apply for these grants. There will also be another set of grants for rural counties, up to $300,000 for 10 counties in New York to help fund EMS education. That's gonna be another federal grant. I don't have the title of it at this point. Steve Kroll brought it up, and once I get information on it, I'll make sure it gets distributed. Update on the Rural EMS Task Force. Do you have anything on that?
They're expecting a report, an actual report to come out of the governor's office sometime prior to the summer.
Well, they said April 1st, and then they said really and changed it to April 2nd.
I was gonna say, we'll see what happens, but, from what I hear from the inside, which is nothing because I can't say that legally because they're not supposed to be talking about it, it sounds like we're gonna get some good stuff out of it. It sounds like we're actually gonna get good recommendations to follow through. It'll be nice that it comes from the area that it does. It should have some heft and some weight with it. It'll be up to us to implement it, but I'm excited to see what they come up with.
The last thing, actually, the department is really disseminating through webinar what their budgetary goals are for the year, and they have encouraged everyone to attend a budgetary update meeting. I know there's one at 4 o'clock today. I'm not quite sure how to get the information out, but there are a lot of budget bills that would do things like
Are these available on the
We'll
website?
send.
We'll send it around.
We'll send it around, so
Yeah.
we have the bills listed.
Nice
in
Vera,
Vera
very
and
nice.
Onion
I was on that one.
Put that,
Yeah.
so there's that spreadsheet that explains the bills and what the recommendations are. So-
Yeah. So, but there's groups of bills to help move the budgetary wishes through. The other thing that is being discussed and talked about is the EMS task force, that they're going to create 5 regions in which they're going to have disaster preparedness activities and personnel. I did send around with the last set of minutes the 2 one-page flyers that came out with that discuss these regions. These are not the regions from last year's budget. These are disaster response zones. So I did send those out with the minutes, the 2 one-page things that described how they want to set up personnel in regions, how they want to structure the regions, what type of resources they want to get, like ambulances on tracks and big buses that can have multiple patients, things like
Can
that.
I just talk about that for a minute?
Sure, Jill,
I have an
please
idea if
do.
you want. Across the state, all the emergency managements, they did a training with us last fall, finishing up the last 2 places right now, but this came about, they actually came and per county, got us together in 5 or 6 counties together, but took actual issues, like severe snowstorms with lack of resources, and are forming this 5-region county, realizing that, when there's big events and the lack of fire, EMS, and law enforcement that we're in right now, that, we have been in for a while, but this has not been updated across the state for years. And looking at how we're gonna pool our resources together, and we're gonna have to pull from other regions that we normally wouldn't work with. And so this is where this came about, and it's a really good program. I definitely encourage anybody who wants to get involved in it, absolutely should, when they, release the information on it. For me in the North Country, ours was geared around weather, because that's the biggest thing that we deal with, and the lack of resources that we have.
That is one thing they did emphasize with the 5 regions. If the emergency was in zone 1, the responses would be from 2, 3, 4, and 5.
Correct.
All right. Award committee. That's me.
We've decided to extend the submission application period until close of business 5 p.m. on Monday, April 1st. We have had a number of award applicants submitted, and that's great, but we're still short in a lot of different areas. Beth had pushed the information out, we're gonna push it back out again. It's easy to do. There seems to be this myth that you have to send somebody through some sort of official council or like committee or whatever to nominate somebody. Anybody can nominate anybody. So just grab the app, and we're all willing to write somebody up when we mess up, but nobody's willing to put pen to paper to say, hey, this one's good. So find somebody and put it through. There's people in our region that are worthy of doing it. Pick somebody and submit them.
All right.
What's the app for that?
The website was distributed with the last minutes. I'll forward. Did I get those to you? Okay, I will make sure you get that forwarded as your new. I'll do it right now.
County reports, Delaware.
Not much new in Delaware, finishing up our spring classes, coming up for the PSE, or the fall classes, looking towards the spring classes. Still working on our QAQI stuff, getting that moving forward. Other than that, not much going on.
Seagull.
We're wrapping up 2 EMT original refresher classes with one that just started at Hartwood College in Oneonta. We got a total of 44 original students and 5 refreshers. We've got a core content that starts in March with 15 students. And one other item to note, Damon's working with Drew Chesney and SUNY Oneonta to establish SUNY Oneonta as a testing site to make it a little more convenient for providers.
Yay.
Harry.
So as you mentioned, this Cobus Hill CON, they want to go live on March 1, which if this doesn't go through, that just can't happen, correct?
They couldn't go live on March 1.
No matter what,
No
right?
matter what.
Yeah, so that's the only thing that's kind of up in the air, right, for them, I guess. Otherwise, nothing really going on Saturday or something, honestly.
Montgomery, nothing new in Montgomery. Fulton?
Got a core class going on in March, and that's about it.
What was that? I'm sorry.
Core
class, thank you.
Hamilton.
Well, we have a EMT class going on in Long Lake right now. We have a CISM development class in Speculator on the 22nd. Joe knows more about them as I do.
What course was that?
Joe might have
It
more
says on the
information about it.
critical incident stress debriefing, we are part of Montgomery Counties right now in Hamilton County, but we have enough interest in Hamilton County that they kind of want to subdivide off of that. So we're going to meet with Montgomery County on the 22nd in Mount Pleasant and discuss.
All right. The old business.
Did we discuss the late payment from the state? Is the region caught up for the REMSCO card? The last meeting, we said that there's
Vouchers and
9 months overdue.
We got word from the state, they're deficient on 2 contracts, the old contract and the new contract which started. New contract which started, we're not gonna see payment for a little while yet because of the transition to state finance from Granite Gateway. I did get word from Samantha Dans that we should be expecting payment from the last quarter of the old contract. So, I don't know if that means the check is in the mail, or it's going to the comptroller for final approval, but it sounds like we're going to at least realize some money from the state, yes. And when that check hits the door, I'll let everybody know. Be cause for celebration.
Pizza party.
All right. New business.
We have brought forth from Hamilton County a member to replace Avis Warner. Thought I had turned that off, sorry. David Brennan has been brought forth to replace Avis, who is retired. Welcome.
You need a motion.
Yes.
Need somebody make a motion to?
I will do that.
Okay.
Second.
There you go.
Woo!
All in favor?
Aye. Rebel was quick.
Anybody else have any other new business?
I do have something to note. Our April meeting will be at SUNY Cobleskill, Upper Champlain Hall. The hotel here is not available. So we will be meeting in, at the college for the April meeting.
What is that date again in April?
April will be
18th.
18th, thank you.
Okay. Next month meeting will be here still.
Yeah.
Don't get confused.
And you're gonna send out that,
Oh, yeah, I'll send.
no, the CON hearing.
Yeah, yeah.
Any other new business? If not, our next meeting will be on March 21st here. And I will take a motion to adjourn.
So moved.
There's a chorus on that.
That's it.
Who was the loudest on that one?
Dave.
33 miles.
Good.
No, they weren't bad, like that first initial storm.
All right. So if they can't do anything, there's basically their own business. Maybe that's probably just file their own, I can't see
I'll be back tomorrow morning.